Have you ever wondered if bipolar disorder is actually a real condition or just a label for normal mood swings? In this video, we're diving deep into what it really means to be bipolar and answering the question that many people ask: do bipolar people truly exist, or is it just a way to explain the ups and downs of everyday life? Understood. I will use the parts you provided and write 2 paragraphs for each, keeping the tone cool and engaging. Bipolar disorder is defined by its name, bipolar, meaning 2 extremes. It's characterized by drastic mood swings that take someone from intense emotional highs, known as mania, to severe lows, recognized as depressive episodes. These shifts aren't your everyday mood changes, they can be extreme and sometimes even dangerous if left untreated. Among the different types, bipolar I and bipolar II are the most common forms. Bipolar I involves full-blown manic episodes that can last for days or even weeks, alongside long periods of debilitating depression. On the other hand, bipolar II features less intense, hypomanic states, which are still disruptive but don't reach the same level of intensity as bipolar I. What separates hypomania from mania is the degree of its impact. Hypomanic episodes, often seen in bipolar II, might even seem beneficial at first. People can be highly productive, energetic, and sociable. But over time, these periods can become overwhelming, leading to exhaustion and poor decision-making. In contrast, the manic episodes in bipolar I often involve behavior that is wildly unpredictable and may even require hospitalization due to the severity of symptoms. The word bipolar is often thrown around in casual conversation, but it's important to understand that this condition isn't about occasional bad days or being moody. Instead, it is a recognized mental health disorder that can disrupt relationships, work, and daily life in profound ways. The extreme nature of these shifts makes it impossible for someone to simply snap out of it. The experiences of people with bipolar disorder are intense and far beyond what most people deal with in everyday mood changes. The stigma around bipolar disorder can make people hesitant to seek help. Many mistakenly believe that bipolar disorder is just an excuse for erratic behavior. However, it's a complex mental health condition deeply rooted in biological and psychological factors. Getting the right diagnosis and understanding these distinctions is essential for providing proper support and treatment, which can help stabilize these mood extremes and bring balance back to life. Manic episodes are often described as feeling like your mind is racing at 1,000 miles per hour. People experiencing mania may feel overly confident, even invincible, with an overwhelming sense of energy. This surge can lead to impulsive and risky decisions, such as going on shopping sprees, making huge investments without considering the risks, or even deciding to quit a job suddenly. The excitement might feel good at first, but it's often followed by significant consequences that come crashing down once the mania subsides. Another common feature of manic episodes is increased irritability, especially when someone or something seems to be slowing you down. The world feels like it's moving too slowly, and there's an impatience that grows with each delay. Speech may become rapid, and thoughts seem to move so quickly that even the person experiencing them struggles to keep up. This kind of pressured speech and thought can be exhausting, not just for the individual but also for those around them. On the other hand, depressive episodes are the complete opposite of mania. It's not just feeling sad, it's an overwhelming sense of hopelessness that drains energy and motivation. Things that used to bring joy no longer seem interesting, and getting out of bed or even just getting through the day feels like an impossible task. There's often a deep sense of worthlessness or guilt, as if the person is to blame for these uncontrollable emotions. These episodes can last weeks or even months, making everyday life extremely challenging. Sleep disruptions are also a significant symptom during both manic and depressive phases. During mania, a person might go for days without feeling the need to sleep, while during depression, they might sleep all day or struggle with insomnia. These sleep patterns further intensify the emotional roller coaster. In the worst cases, depressive episodes can lead to thoughts of suicide, which makes early intervention and understanding of these symptoms crucial for anyone dealing with bipolar disorder. The causes of bipolar disorder are complex, involving both biological and environmental factors. One major theory suggests that the condition is related to problems in how the brain manages its connections. Normally, the brain prunes or adjusts its neural pathways to keep things efficient, but in bipolar disorder, this process may be faulty. This results in abnormal patterns of thought and behavior, which manifest as the dramatic mood shifts typical of the condition. Neurotransmitters, the chemicals in the brain that regulate mood, also play a crucial role. Dopamine, known as the feel-good neurotransmitter, can be found in excess during manic episodes. This excess is what drives the heightened energy, grandiose ideas, and sometimes psychotic symptoms like delusions or hallucinations. Conversely, during depressive phases, levels of dopamine and other neurotransmitters like serotonin can plummet, leading to the deep sadness and lack of motivation that characterizes these episodes. Genetics also contribute significantly to the risk of developing bipolar disorder. If someone has a close family member with the condition, their chances of having it themselves are higher. However, no single gene has been pinpointed as the cause. Instead, it's likely a combination of multiple genetic factors interacting in complex ways. Environmental factors, such as traumatic experiences or significant stress, often act as triggers for those who are already genetically predisposed. Another key area of research involves the amygdala, a part of the brain involved in emotional processing. In people with bipolar disorder, the amygdala may be overactive, leading to exaggerated responses to both positive and negative experiences. This helps explain why people with bipolar disorder can feel emotions so intensely, from extreme happiness during manic phases to profound despair during depressive ones. The interplay of these biological and environmental factors makes bipolar disorder a uniquely challenging condition to understand and manage. Managing bipolar disorder effectively often requires a combination of treatments. Medications are a fundamental part of this, with mood stabilizers like lithium helping to keep the highs and lows from becoming too extreme. Antipsychotic medications may also be prescribed, especially during manic episodes when a person might lose touch with reality. These medications help to bring a sense of stability, making the dramatic shifts in mood more manageable and less disruptive to daily life. Therapy is another critical component of treatment. Cognitive behavioral therapy, CBT, helps individuals recognize and change harmful thought patterns that can exacerbate symptoms. For instance, during depressive phases, therapy can assist in challenging feelings of hopelessness and guilt, while during manic phases, it can help in identifying the early warning signs before things get out of hand. Therapy also offers strategies for dealing with triggers, those situations or events that might lead to an episode. Lifestyle changes play a massive role in treatment success. Regular exercise has been shown to help regulate mood, and maintaining a consistent sleep schedule can prevent the onset of both manic and depressive episodes. Avoiding substances like drugs and alcohol is crucial, as they can interact negatively with medications and worsen mood instability. Developing a strong support network, friends, family, or even a support group, provides additional emotional backing and can be a key part of managing bipolar disorder effectively. In severe cases where medication and therapy aren't enough, electroconvulsive therapy, ECT, might be recommended. Though it can sound intimidating, ECT has proven effective for those who haven't responded to other treatments, particularly in severe depressive episodes. It involves brief electrical stimulation of the brain while the patient is under anesthesia, helping to reset the brain's chemical balance. While it's not for everyone, it remains an important option for individuals who need additional help in managing their symptoms. Acceptance is a cornerstone of living well with bipolar disorder. Many people struggle initially with acknowledging that they have a mental health condition, often due to stigma or misunderstanding. However, recognizing the reality of bipolar disorder allows individuals to take the necessary steps toward managing it effectively. This acceptance isn't just personal, it needs to come from family, friends, and society at large to help dismantle the misconceptions that often surround the disorder. Proper treatment can make a world of difference. With the right combination of medication, therapy, and lifestyle changes, people with bipolar disorder can lead balanced, fulfilling lives. It's crucial to understand that having bipolar disorder doesn't mean a person is incapable or broken. Instead, it's a medical condition that requires the same attention and care as any physical illness. With a structured plan and support, the highs and lows can become more predictable, and life can be enjoyed in a steady and meaningful way. Self-care is another essential aspect of managing bipolar disorder. People with bipolar often need to be mindful of their energy levels, triggers, and stressors. Learning to listen to their bodies and recognizing when things feel off is a powerful tool in managing their condition. Activities like meditation, creative hobbies, or simply setting boundaries in relationships can make a significant difference in maintaining mental health. Support from others is also irreplaceable. Family members, friends, and partners play a vital role in creating an environment of understanding and patience. Their support can provide the emotional safety net needed to navigate difficult times. Whether it's offering a listening ear, helping with daily tasks during depressive episodes, or simply being there, this kind of involvement can be a game changer in ensuring that someone with bipolar disorder does not feel alone in their journey. If you found this video helpful, consider subscribing to the channel and leaving a like. It really helps in spreading awareness about mental health topics like this one. Also, make sure to check out another video on our channel titled, "The Truth About Anxiety, Why It's More Than Just Stress." In that video, we break down what anxiety really feels like, the science behind it, and how you can manage it effectively. It's packed with insights that can help you or someone you know.